with the next presentation. And we continue to be in the area of face and head and neck. And this time with something probably that you haven't heard a presentation on. This is the first time that I'm giving presentation in such a wide audience that it's not dental professionals. My presentation is going to be use of SCENAR in dental practice. Can I ask the audience, do we have any dental professional here? Any dentists? No. Well, I hope after my presentation you will see how we'll have a little bit different view on how important is your mouth and teeth, and how can we use SCENAR to improve overall health, being, and well-being. Can you hear me better now? Okay. Yes. Perfect. Well, I am one of the minority dental professionals in the United States and maybe in the world. I have a little bit of my water, thank you. I am a holistic dentist. I also have specialty in periodontics and implants. I'm doing a lot of, I used to do a lot of open gum surgeries and cosmetic surgeries in the mouth. And I was trained in Europe. I'm originally from Bulgaria, so I graduated, my first doctor in dentistry was in Bulgaria. And then I studied about 10 years to get all my degrees in Boston University here in the United States. Presently, I'm working in around Boston area in the town of Brookline. Thank you. I have water there, but it's for some reason my voice suddenly disappeared. I will start with the topic of holistic medicine and dentistry because it's a very interesting topic, and I think it's the topic that gathered us all together here. As you heard many times, SCENAR is one of the most advanced holistic technology. And also, I could say SCENAR is actually science that improves our knowledge and understanding of the body as a whole system. My belief as a holistic dentist is that holistic means a whole part. And our body, although it's made of a lot of cells and organs and tissues, we function as a one being, and every part has its important role, and if any part does not work correctly, the whole body suffers, and we have disturbance of the well-being. It's not only a local disease, it has impact on our life and well-being as a total body. So holistic medicine, it's considered, when we talk also about whole being, there are new advancements in the quantum physics that teaches us and gives us perspective not only on the body as a physical body, but also on the body as different layers of the bodies that Dr. Ravenko compared to Russian matryoshka, with the one into each other. But if we can imagine, those bodies, they are not, they're not physically one into each other. They are layers that actually it's around the physical body, and most of those bodies we do not see. But they have a great impact on our overall physical body and expression of our health and disease. The other important concept that SCENAR was based as technology and science is the holographic concept. This concept is also very well known and widespread as a knowledge at the moment with the recent discoveries of quantum physics. And the main concept is the holographic principle. Our universe it's based and it's built on the holographic principle. What does this mean? And so do our body. The holographic principle means that the whole information from the universe, to build the whole universe, is presented in every single building block of the universe, which means the smallest particle, that is building block of the universe can have the information and represents the whole universe. The atom has the information for the whole universe, and the whole universe, at the same time, the concept of functioning and building in the physical and non-physical level is presented also in the universe as an atom. In the same principle, our body is also based on the holographic principle, and every cell has the information for building up the whole body. And we can see this very, vividly and use it because we have a lot of parts of the body that represent the whole body physically. Some of them are our palms, our feet, our ears, our tongue, and I will talk a little bit about teeth that, I have a special interest of alternative knowledge about the mouth and the teeth that you're probably not going to hear of any dentist talking, in the everyday life that you go to. So let me see, a little bit get your attention. How happy are you with your teeth? Who is in love with their teeth? Raise your hands. Not too many people. How come? So, to continue with the previous presentation, about aging and about the beauty, the beauty of the face is also with the beauty of your smile. Isn't it? Part of your beauty. Doesn't matter if it's female or male. You consider yourself handsome when you have those nice, healthy teeth with nice, healthy gums. When you smile, people smile also at you, and you don't have any remorse or any guilt about anything, and you smile, with joy. So that, that's the first importance of the holistic part. The holistic, I already, mentioned a little bit about this. Our body is not, the physical part, as most of you know who study physiology and pathophysiology. The main principle, of everything working is actually the nervous impulse and movement of energy. So our bodies, this is part of the SCENAR technology that accept that the SCENAR is working with the energy. They took all the knowledge of the Chinese medicine and the Eastern medicine about the reflexology zones, about the meridians, about how the energy, the qi, moves inside the body and how it makes our bodies to work. Our bodies have, as I told you, very different, in different layers, and you can see, the energy part that connects us with the energy of the cosmos, of the energy of the universe. And since we are part of this hologram, we have all the knowledge and all the energetic points in our bodies that are representing the universe itself. I'm not going to get deeper in this knowledge. Everybody that is interested can go and study chakras and study etheric bodies and how many bodies we have. But in terms of our, presentation, the most important part is the mental, emotional, and electric, body and the physical body that are layers of our immediate physical body. That's another picture of bodies that actually are used. Also, SCENAR uses the energy of those bodies, to work with our physical holographic system. As I already stated, the importance of the teeth. One thing that you probably forgot from the early study of development, the teeth and brain are developed from the same layer, which is the ectoderm. And, for this reason, especially the upper front teeth are very connected to the brain, and they are considered the direct extension of the brain. And also, another very important another very important information that probably not too many people realizes, our teeth are crystals. They are built by the, they are based on the carbon crystals. And what is the role of the crystal in our everyday life? Anybody?
They can form, they can shape.
They can shape, they can be fluids. Where do you have crystals?
They can take information.
Okay, information is the part. Everybody has crystal at the moment in their purse, your cell phones, your computers, all those microchips. They're based on crystal. Crystals are, in the human history and civilizations, crystals were always very important technology. Since Atlantis to our days, we're using the technologies of crystals. And this technology is the main capacity of the crystal is to store information and communicate the information. So if you think, we have a lot of crystal structures in our body. Fluids, they have crystal properties. But if you think about it, your teeth are crystals. So it's an untapped source that nobody studied actually, in an alternative or mainstream medicine and physiology way. What is the role of our teeth to store the history of our life, of our human being as a race? Because I think, this is something that it's definitely, not studied, but very well, at least as challenges to think about. Using SCENAR also, you just heard in the previous presentation, SCENAR can release the emotions. We study, we store in our teeth also emotions, and we store the history of our disease and our health, and probably not, genetically, not only in this life, but from previous generations as well. Everybody, has an experience, or see people with crooked teeth, or, people with certain genetic disorders that come as a history, in their life. Holistic dentistry, why, what exactly, a part of the philosophy in the everyday life, what does it mean? On the first place, I look at the whole body, and I consider when I have patients, I don't start drilling the tooth and putting fillings or doing surgery or anything. I have very thorough medical history and anamnesa, how it's in Russian. That involves with the social life, with the emotional history, genetics, of course, and family history, and also nutrition, which is not part of everyday, when you go to your dentist or your hygienist. How many of you, somebody asks you about your emotional life or social experience or anything? So this is part of what I do, first. And, the other very important part of the holistic dentistry and view is materials. What kind of materials are used, to restore your mouth to health? You might know, you might not know, one of the most toxic materials, two of the most toxic materials on earth are in your mouth. One is amalgam with mercury, that we call mercury fillings, and the other one is fluoride. Anybody that is interested to know why and how, there are a lot of information on YouTube, there are a lot of movies that you can watch. But, any time that you touch the tooth with amalgam fillings, it releases mercury in your body. And the mercury is one of the most ubiquitous, but one of the most dangerous poison on earth that actually leads to aging. And this is one reason why we age so fast, among a lot of others. Of course, everything is environmental, mostly. But mercury is one of the most important toxins in our body that leads to premature aging and to a lot of degenerative diseases that we experience later in our life. You think that your arthritis and your high blood pressure, they just come with the old age. They don't. I'm not saying, for sure that mercury is the reason for everything, but, fluoride and mercury are neurotoxins, and they damage the axons and dendrites of our nerve cells. They interrupt the communication. They change the communication, so you have a wrong information flowing, around the body. And from there on, you have totally disturbed, homeokinesis or homeostasis, whatever, you want to call it. Some materials and toxins, I'm very concerned when people come to me to remove those materials from the body without damaging or further intoxifying the body. So I do it under special protocols, to remove the mercury fillings, and also advise patients, on nutrition, how to use any material without being toxified. Another part of the holistic dentistry that is very important, also for all the SCENAR therapists, just to give you a perspective in mind, that when you treat any problem, any part, just think about teeth. Teeth are very easily accessible. You don't need an intravaginal probe, and this is one table that shows you the connection of the teeth with the meridians, based on the Chinese medicine, and also with different organs. So if you would like to have for example, stimulation or treat particular condition or organ, I use it. I see very good results. But I just suggest remember my presentation and think about teeth, because you can use SCENAR to treat to influence through the teeth. You can influence the other organs and the other meridians.
So when using the scanner, do you use the probe? Or you
We'll get to it. Okay. Yeah, we use a special probe, and so here, I'm just summarizing, the pathology in the mouth, that it's connected, and what it is. We have soft tissue and hard tissue. Obviously, we have gums, and we have tongue, and we have mucosa in the mouth, and we have hard tissue. We have teeth that we already, saw that they have a very complex structure, and they're crystals, and we have bone. So all the diseases and pathologies that in the body for the soft and hard tissue, they are coming also to play a role in the mouth. The very important thing, though, for the mouth, that I don't know how many doctors, usually they open the mouth, they check, the tongue and in general, but your mouth, just like your skin, is a mirror of your body. Everything that happens in the body reflects, in certain way in the mouth. And if you can read it, especially if you use the SCENAR to, you can easily find the connections between pathology in the body and the mirroring expression in the mouth. The main ones, of course, the symptoms, anemia is very well represented with changes in the mouth, especially on the tongue, gastrointestinal problems, and toxicity of any kind. In the face, we have temporomandibular joints, and we have all the nerves that are coming from the brain, the 12 central nerves from the brain that supply, innervate, the face muscles, and also sensitive innervation of the teeth and gums and skin. What is another important thing? I'm summarizing, conditions in the mouth that are very connected to the overall health that you might know, you might not, but it's important to me. It's important for you to understand and look for it, because when people come with problems in their neck, problems in their spine, problems, of the muscles, any pain of musculoskeletal origin, in my view, as a holistic dentist, you have to look for dental, for part of the reason it's always dental. It's either temporomandibular joint, it's oral occlusion, and you have to open the mouth of patients and look at their teeth. You have to look, to see if they have their back teeth, because any problem with the neck, if the patient doesn't have back teeth, you will never resolve it completely, even with SCENAR, if the patient doesn't restore the bite and the height of the face. This is excruciatingly important. The other very important syndrome that it's absolutely not well studied in dentistry, later part in medicine, it's called dental distress syndrome. And this syndrome is based on over-touching the front teeth. As I already told you, the upper front teeth are a direct extension of the brain. If you have heavy occlusion or heavy, touching on the front teeth, you have all kinds of syndromes and diseases that, start, and they would not resolve completely until you resolve this situation. I'm giving here some, that's called proprioception, and this proprioception is excruciatingly important in overall well-being and health of the person. I'm giving some information here. Proprioception between your front teeth is so delicate that you can tell the difference between the thickness of an eyelash. And it's as little as 1 to 1/1,000,000th of an inch. That's how sensitive of proprioceptions are your front teeth. There is no other proprioception in the body of that amplitude. I'm not gonna get, you can read and educate yourself. The proprioception is a specific perception of different things in the body that is directly connected to the brain, the way the brain interprets different things. Over 50% of the biofeedback to the brain originates in the 68 pairs of facial muscles. And since the thalamus is also regulate hypothalamus, the part of the brain that is considered responsible for stress mechanism, when you have overtouched of the front teeth, what do you have? You have stress. And stress is one of the major foundational part why the SCENAR technology was developed, right? Because we want to remove the stress, and we study the stress, with the beginning of Dr. Cellier, the French doctor, and this is part of the very science of SCENAR. We want to remove the stress and go to and work with the adaptation. This stress, this stress is kind of hidden. You don't really think about it. It's not a danger of your life. It's not that you don't have money or you have to pay your landlord. This stress is a constant, every single minute, every single moment when you touch your front teeth. It stresses the whole body, throws the whole autonomic nervous system and the central nervous system. Since it's directly processed with the proprioception to your brain. How do we treat this? It's very important for you to have, of course, your back teeth, and it's treated in. I treat this with SCENAR, integrative method also, with the same laser Q1000 laser that was used for cosmetic purpose, and with the proprioceptive guides that are called miracle bite taps. So I have to reprogram the brain, to give the enough space between the two teeth, and this is done with a special thickness of special materials, the taps that are put on between the teeth. The other very important condition that nobody pays attention to, or very little attention, especially from doctors, even dentists, they don't understand. It's very easy if you know the anatomy of the tooth to understand what's going on. But at the same time, yet for whatever reason, dental professionals and the whole world is closing their eyes, in front of this very, very dangerous situation for the body and throwing the whole body into the disease mode. It's called periapical abscess. It's a very heavy infection. When the nerve inside the tooth, and I'm giving you here the very simple anatomy of the tooth, the part is something that it's very important for you to understand, that your part of the tooth that is inside the outside part enamel is 99% inorganic. This is the biggest crystal. The second layer is called dentin, and has 70% inorganic material, 30% proteins. And it's also spanned by very nanoscopic sizes of microcanals. And the part of the pulp, which is the brain of the tooth, has a projection in those tiny small canals. Well, what happens when you have this infection from caries and decay and again kills the nerve? You have a necrosis, you have gram-negative bacteria, very nasty bacteria. What happens in liquidized, liquid necrosis or dry necrosis, whatever, you have in those tiny small nanoscopic canals. And there you have bacteria, they have their toxins, and you have necrotic tissue. Are you going to leave necrotic tissue in the body, open necrotic infected tissue in the body? I'm asking doctors, any wound that you have, anything, are you going to leave it? No, right? So why are the dental professionals deciding, this is nanoscopic canals. They cannot go, of course, root canal treatment, they clean the necrotic tissue from the main canal. They put 100% bleach. They put very heavy, nasty antibacterial, to sterilize the canal. But what about those small canals? You have bacteria there. You have toxins for the rest of your life. So, in my opinion, as a holistic dentist, I do not accept, root canal treatment as a good treatment, for the whole body. Yes, you can save the tooth to stay your own tooth in your mouth. But, if you think about the body, this infection and this chronic abscess, which with root canal treatment, yes, you can disappear these shadows that you see here of melted bone on the x-ray. Yes, it can disappear. But, with SCENAR, I have a very good success, I don't know if I'm going to have the time to tell you about the cases. With the SCENAR and laser, I had a very good success removing all those shadows and all those, and restoring the bone completely around the tooth with the root canal. But this was because I couldn't extract the tooth, for whatever reason. The patient was very massive, alcoholic, he couldn't get anesthetized, to the level so I can extract the tooth. But, that's something that, again, I want you to have, how many people have the root canals in their life? And have root canal teeth in their mouth? Probably almost everybody. Maybe you don't know it, you forgot about it. So, I will suggest that you do x-rays and see how many teeth have this shadow and just remove them because they are the most toxic and the most, disadvantaged part, that releases constantly toxins and bacteria inside the body and, and causes degenerative problems and focal, infection. Right. How many people can keep the scanner all day long, to keep, because yes, you scan it, the pain goes away, and then, after several months or a year, the shadow comes back.
No, after the root canal, the storage is still there of the bacteria, right?
Right. The SCENAR does not kill bacteria. SCENAR stimulates self-healing properties. It's a long story to talk about the immunity and how the tooth is the most unique organ in your body, because of the structure and the anatomy. The immune cells, I have a lot of friends that are Reiki masters, energy workers, and they constantly ask me, why can't you do, I'm Reiki second level, why, do a lot of other energy, modalities. Why can't you do energy treatments and, heal this tooth? I can't because of the unique anatomy and because of the infection that it's always there when it gets there.
So how do you keep it with SCENAR?
I'll get to it, I have. So one very important thing, I'm just going to quickly roll over, the basic things about the SCENAR. Don't forget the SCENAR sends a pulse, measure the time reaction of the tissue to that pulse, and modifies the pulse in order to create a tendency toward what might be the best called healing pattern, for the body. And that's what we used in any modality of treatment. Those are the general impact of the scanner that I used, that are very, very beneficial for the dental treatment in any kind also. Anti-inflammatory, anti-edema, anti-allergic, and I use it in an any-day practice, to cumbersome, those effects. There were a lot of questions about the frequency. I'm giving a little bit of information about the frequency. 6 to 90 is the general treatments and the beginning of every treatment. The high frequencies are for acute processes. The lower frequencies are for chronic. And there are frequencies that I used usually in the middle, like 45 I use for bone regeneration when I do implants and I do regenerative periosurgeries. FM bar is the frequency that brings memory. I also use it sometimes, again for regenerative purposes. Swing can be combined and beneficial, as you saw, for facial muscles and in dentistry as well for treatment of periodontal ligaments and any kind of periodontal issues and gum disease. This is how to choose depth. That you also, for very sensitive patients, is one. Choose to speed up the body response in emergency situations. The higher depth, 4-3. The higher the depth, the sooner there will be the response. This is the major thing that we need to know about the SCENAR. The main 3 paths, 6 points. This is the kind of the main core of the SCENAR treatment. 6 points I used a lot as a therapy. Emergencies in dental office, they're not, as in the emergency room, but they happen, especially, with the surgical procedures. A patient don't eat, you put anesthetic, they drop the blood pressure, they drop the sugar, and they faint. So those are the areas that I use SCENAR. You can use them with any emergency situation, including shock. Those are the zones that you work. Sometimes, if I don't have SCENAR close to me, I just put the pressure points, with the pressure to play with the blood pressure, to raise it or to drop it, depends on the situation. I use a lot of pirogov ring, those are the technique around the neck to stimulate the immune system, and also for pain syndromes. I always use it if I work with the pain in the face and the teeth. That's the part of the technique. You're going to use it. You're going to, see it for the courses. It's studied in the angel wings. This technique, I want to give you a little bit different perspective that you might not know. The previous presenter explained it very well. It's used for a lot of things. One, perspective that I want to know, how many people know what the bowling ball syndrome is? Bowling ball syndrome. Chiropractors and people with, that use. So bowling ball syndrome, in very short, it's when, your head, because of the gravity and because of the traumas and muscle memory and spasms, you have a changes of the skeletal position of the head. So the foramen magnum is not on top of the spine anymore. Angel wings is the technique of immediate adjustment for this. So I use it for any, also for any pain, as and in the face and teeth, and also for migraines, and especially when I have the collapse of the posterior. We talked about the dental stress syndrome, and TMJ. I always start with this technique. I have to release and reposition and reprogram the muscles, and then I start using, the lasers together with SCENAR and putting things in the mouth to adjust the occlusion and height of the face and so forth.
How long for the time?
Pardon me?
How long is it?
I need to see at least 3 times, this on each side. The other thing I wanted to mention, since I showed the anatomy here, the sternocleidomastoideus, for some people, the point is not here. It's way high back here at the angle of the jaw, where you have the attachment. So try to find the spot across, along the whole muscle. What? It's very important. I'm just reminding in terms of the topography, anatomy of the face. You can use the reciprocal zones and symmetrical zones. The other very major fundamental knowledge in SCENAR therapy, which I think comes from ancient knowledge of shamans. What are shamans doing when you break your hand or you break your leg? Are they going to start working on the leg that broke? Yeah, you have fractured? They start working on the healthy side. So I use the same technique, especially in dentistry with pain. I always start with a symmetrical tooth. Since I am there, I have 4 symmetrical teeth. Actually, I have 4 quadrants, and I always use all 4 quadrants, before I go to the tooth that has pain. And believe it or not, most of the time I don't need even to treat the tooth with the pain because the pain is already gone. At the 6th point, I do this reciprocal zone, the pain is gone already. It depends. Everybody's individual. You just do it until the pain, you scale the pain on 1 to 10, and then if the pain becomes 1 or 2, I send the patient home. If it was just an emergency for the release of pain. Otherwise, with any dental problem, I take care of the dental problem itself. I have to resolve, find the reason why it is, and then I resolve it, with dental means that I have to deal with directly with dental problems. This is showing the 4 reciprocal zones. Sometimes I use them. Depends on the case. Mushrooms, those that with the shungite or not shungite, they are the best approach here, because you can use them at the same time. Ear, this is one, to show you that the ear is actually the full holographic representation of the body. I mean, so the tongue, the face, the palms, you have it everywhere. But ear is more accessible. Sometimes, if the tongue, you activate the zones by just licking the SCENAR or using the different probe for different organs on the tongue. But since the tongue is very sensitive, I prefer to use it for the ear. Those are the self-treatment. If you have a SCENAR, you can use SCENAR for self-treating, for emergency, in any dental situation. Okay, going to periodontal disease. After the dental stress syndrome, this is the other disease that it's called, I call myself specialist in periodontal medicine. Why? Because periodontal disease is one of the diseases that is most tightly connected to a lot of very important health problems today in our society. Cardiovascular disease, strokes, Alzheimer's, and some other infectious diseases in the body, including the low weight babies. Why? Periodontal disease, has a lot of reasons, but direct reasons is infection. 6 bacteria that were identified for the last 20 years. Most of them are gram-negative, very nasty. They don't like oxygen. They find, when you eat, you have plaque on the teeth. You don't brush correctly. The plaque attracts, bacteria because you're giving them food. They go under the gum, and that's it. You can't get them out anymore from there, even if you, brush your teeth for 24/7. So, they start multiplying, releasing enzymes, together with the immune response from the body. They start destruction of the bone and destruction of the ligament that holds inside the tooth inside the bone in the jaw, and eventually the tooth falls out and you have premature loss of teeth. That's the dental problem. Let's look now what is the medical problem. Why is periodontal disease so important, in the medical field recently? Tons of research, every, American Heart Association, almost every, medical doctors, they know now that they have to account for this if they have patients with cardiovascular problems. Because those bacteria, they can internalize in the epithelium cells. They can invade the epithelium cell. The epithelium cell, they can invade also the epithelium cell of the blood vessel, pierce the blood vessel, and then go with the bloodstream everywhere. But they like, the arteries. So the new theory of formation of atherosclerosis plaque The very first event, before, foaming, before the cholesterols, before everything else, the very first level of wounding of the wall of the blood vessel comes from bacteria from your mouth. Those are the periodontal pathogens that they've been found with a lot of different kind of research. Recently there was even live bacteria where they were able to culture the live bacteria from atherosclerotic plaque to show direct, connection, of this disease with the mouth. Let's don't go there because I tried, I have a very complex treatment, yes. I will discuss it later on if somebody wants. I'll give direct, answer of this, how I do it. So, this is with the periodontal disease, directly connected to the, to overall well-being and oral health. This is my approach to treatment. I treat it on many different levels. Change lifestyle of the patient, usually nutrition, alcohol habits, smoking. Smoking is a very important factor. #1 killer of the teeth of everything. 100% of smokers have periodontal disease at some kind of level. Maybe not aggressive periodontitis, although most of the smokers have aggressive periodontitis. They will lose their teeth much earlier than other patients that they're not smokers. Smoking cessation, this is part of this type of treatment. SCENAR, thank you, SCENAR, specialist and that you create the toothbrush. Toothbrush is a great for everyday use, to keep the stimulation of the cells. And to keep, I don't have the direct research. I didn't do studies, to check the cells and how many bacteria are dying. But I see a very, very good result with the regular use of, after, of course, the deep cleaning and removing the plaque, calculus, and bacteria, directly with physically. I see it, very well accepted and very good results with the SCENAR brush. So anybody that has a gum problem, do the specialty treatment with, in dental office, deep cleaning, whatever it needs, and do the, use the SCENAR brush. Yes?
I know somebody who has a genetic condition that her gums recede as she ages.
Yes?
Will the SCENAR toothbrush help her with that?
There is a technique with the brush that I'm going to good question, thank you. I'm just going to give you a very short explanation about any brush, about recession. Recession comes also with electronic brushes. Recession is very often a sign because people leave the brush to brush by itself. The brush has to be, to brush, half of the brush has to be on the gum, half of the brush has to be on the tooth, and the movement that you need to activate is a circle, like this, or a vertical movement that brushes out of the gum. So for the upper teeth, it's going to be like this. For the lower teeth, it's going to be like this. Absolutely the same rules apply to the SCENAR brush. It doesn't, the only thing with the SCENAR brush is a very, it's a very light touch, that you need to apply. No, wait. I'm out of time? Okay. TMJ problems. Any questions about the periodontal disease? Okay. TMJ problems. Very very quickly. I explain you. The TMJ together with the dental stress syndrome. Dental stress syndrome is one of the major roles for developing TMJ. The other stuff are, of course, postures. The muscle tension, whiplashes, people have whiplashes a lot since we're driving. Now we are creatures on cars in our civilization. So, this is a very common trauma. But even if you don't feel it anymore in your neck, it always affects your TMJ. TMJ is very connected to to grinding your teeth. So I use both. I use SCENAR and the low-level laser and, appliances in the mouth. So this is the short, but for TMJ, always use the color zone. and other general zones in the treatment. This is some information. I didn't have too many patients. I have only 2 patients with a neurological, with a trigeminal neuralgia. As you know, those are one of the most severe painful syndromes in the mouth, in the body. It's excruciating pain, debilitating pain that leads to, most of the time, to suicide of the patients. SCENAR is working miracles with it. Also, I have 2 cases that I was able to regenerate the nerve after oral surgeon extracted the lower wisdom teeth. The surgery was very involved, and they severed or damaged the mandibular nerve. And it took me, more than 10 sessions. But I was able to, reverse the situation and get the sensitivity in the teeth probably 80 to 90%. Tongue therapy, I already talked about holistic and holographic representation of the whole body on the tongue. Tongue is very important. Chinese diagnose everything by just looking at your tongue. And, if you learn to do it, I am almost any other patients that come to my office, I can diagnose immediately gastrointestinal problems. And I'm happy to report that I saved a lot of patients, in the long-term suffering, because I was first to diagnose them with reflux disease, and to recommend for them to go to further treatment and specialists and help them with. If I have time, I am a dentist. I don't have time to treat all those conditions. But, using it in dentistry and recommending them for them to go to doctors or alternative doctors, that helps a lot to patients. Toothache, I mentioned a lot of, some addressed a lot about the toothache. Medical history is very important. Trauma, infection, pulp necrosis, occlusal problems, all those can cause toothache. What I want to tell you about something that I saw and I'm using. I don't know if everybody has an expertise of using it that way. With the toothache, and especially with addressing the abscess, I use the acupuncture electrode. I use 2 SCENARs, and I put the electrodes on both the buccal side and the lingual side of the tooth. And I have a great immediate relief of pain, and also of the abscess, and very good treatment in this. The probe can be developed. I think to have to split and have 2 of those endings of the probe. The other issue in the mouth, which is especially a big issue in America, I don't know about the other countries, this is the individualizing of the probe for patients. And I also want to, kind of set this as a, if Okabe Rhythm wants to help me or, the other dentists, I don't know how many other dentists are using it, you cannot put anything that is not sterilized. You cannot take the probe, wipe it with the alcohol, and then use it for the next patient. And I usually, if I need to treat the patients with the probes, I usually ask them to buy it, but sometimes when it's in the emergency, and I don't have the clean, I don't have a new probe, that's the problem. It's not FDA approved. And this is legislation, this society here, they can sue you for anything, so I'm not going there. Okay, so another very good points for treating the pain is at the corner of the nose and the upper corner of the tooth with the with the bowl, this bowl electrodes. You put the one electrode of the small mushrooms. You put one electrode here and another electrode here for 30 seconds, and it has a very good effect. We already talked about different stages. You know, the periodontal disease, according to classification now, it's 1 to 4, 1 being gingivitis. You know, people usually talk gingivitis separately, but now it's the same ball game. It's just a different level of infection and changes in the tissue. Those are the most, in wrapping up, and those are the most places that I use the SCENAR in my practice. I always, with every patient, I don't charge the patient. I do SCENAR after each tooth extraction. I do SCENAR after each periodontal surgery. I do SCENAR after each implant placement. And I have great results. Patients do not have pain. They don't take medication, which is, the actual goal, because we are a toxic society, and the less medication you take, the better. So one more thumb for the SCENAR. Facial pain, migraines, neck, shoulder pain, lesions of endodontic origin that I just talked about, abscesses, bone regeneration, failing implants. I use this laser. I have a MD YAG laser. I use SCENAR plus this laser, and in combination with the bone graft. I don't have any implants that I extracted in the patient's mouth for the last 5-6 years. Okay, and that's my beautiful Boston.
I have a question. What about implants in relation to missing teeth? Somebody had asked me about that.
Well, my holistic view is any tooth with a root canal extracted. Right now, the zirconia implants are approved by FDA, and before you had to go to Germany to place them in your mouth. Zirconium implant. They are, porcelain zirconia implant. They are very, very mild. The body loves them. If you have an infection of the whole mouth, there are pictures that they show. I don't have it, I didn't have time to pull it from the internet. But the zirconia company that produces that makes the implants, the manufacturer, they have this picture of the whole mouth is infected with gums bleeding and red, and the only place that the gum was pink and healthy was around the zirconia implant.
Zirconia is made out of, what is it made out of?
Zirconia is considered, well, on lame language they consider it, non-metal, but actually zirconia is a metal. Zirconia is a porcelain metal. Yeah.
So what do you recommend for somebody who's done root canal and there's some bacteria? Would you still say hydrogen peroxide with bicarbonate of soda may work?
Okay, hydrogen peroxide is a great treatment. There is a book that's called 1 Minute Miracle Cure. Just take the protocol, use it for everything. I cannot use it officially. I'm I'm a holistic dentist, but I practice integrative practices because I don't want to lose my license. And it's a license in America. This is a great. I have knowledge. That's my part. To give the knowledge to patients, and then they will decide for their own health. My role is to diagnose, to find the reason, not to mask the symptoms as a holistic practitioner, to find the reason why this happens in the body, to address to address the treatment by removing the reason and helping the body to heal. And SCENAR is number one technology to use for this, but together with all other things, of course, nutrition, changing for lifestyle, vitamins, the supplements, hydrogen peroxide. Not only hydrogen peroxide, chlorine is very good too. It's nasty taste, but works wonders. There are a lot of alternative technologies and knowledge. I all disclose to patients, but the patient is the one to decide what to do. I do not treat any general disease in my office.
What kind of nutrition or vitamins do you normally recommend for dental
It's based on the patient. That's why number one is to take a very good medical history, because everybody is different. And sometimes I give them what I know, but I'm not a nutritionist. I work with the alternative nutritionists that I will send the patients, and they need a lot of tests as well. to check for vitamin D deficiency, to check for other, I practice also informed decision and also, science-based because I'm a scientist. I have a doctor of science in the oral biology and periodontology. So I am very integrative in my approach. I tell them this is the science behind it. It has, research behind it. That's what the alternative, route is. That's what the mainstream route is.
There's a book that talks about healing dental problems naturally.
Right. A lot of books, you have to, don't forget only one thing. A lot of books, they're based on the experiment and experience of different patients. Every single body is different, especially in the mouth. The teeth are your character. They're so different from anybody else that not two patients can have absolutely the same result with anything, all the approaches, than like the other patient. So there is no uniform answer to this. Yes?
Have you ever heard about using a mild silver protein, silver colloid for?
Yes, I used to. There used to be a very good company, extremely good company that disappeared. I don't know why. To make a colloidal silver. Colloidal silver is great for mouth rinses, and after surgery, I usually use hydrogen peroxide diluted, food-grade hydrogen peroxide. That's my recommendation for disinfection after surgeries. I don't use Listerine. I don't use chlorhexidine, because there are a lot of problems with them, and they're very toxic. So, again, I don't have time to go in details for what holistic approach, and particularly my approach, because I'm a periodontist, and I think I'm the only holistic periodontist in the United States.
There is a machine that can be used for generating your own colloidal silver.
Let's don't get in there. You can guys discuss this. Those machines are not the same. Yes, they can cause for you to engulf a lot of silver and cause condition, that it's extreme silver. Yes.
No, there's one that it has been approved by health department.
Yes, we can talk about that. Anything about SCENAR and use the SCENAR in dental practice. That's or the holistic approach. You can. If not, yeah.
What about making a sort of a gum tray with contacts?
Yeah, I didn't get to this. There is existing approach. It's called. I'm using it. I listed here. I didn't talk about it because I didn't want to prolong my presentation. It's called PerioProtect. It's a device that needs to be taken impression in the dental office. And they make a gel based on hydrogen peroxide. You put it twice. I use it only for prophylaxis, not for treatment of periodontal disease or any kind of infections in the mouth. I use it only as a prophylaxis. I do everything that I need to achieve the total health of the gum. And as a prophylaxis in periodontal patients and smokers, I use, it's called PerioProtect. It's perioprotect.com. It's the website. You can read a lot about the bacteria and infection and so forth. You use this gel twice a day. You put it in in the tray, put it on top of your teeth twice a day after you brush your teeth. There is no infection anymore. The periodontal disease doesn't come back.
I was talking about using the scanner contacts directly to the gum.
Oh yes, I use the scanner to go with those probes. The only problem I have is about the probe. The individualized probes for this. Yes, I use the scanner together with laser, but this is very time consuming. I don't use it for every single patient. I use it for very severe cases that I can't have immediately. I can't have a resolution within, say, 4 weeks or something. I will use this, and I also use the vitamin C rejuvenation with electrophoresis. That it's not used in anybody in the United States. Okay, any other question?
You need to write a book about it.
Yes. Thank you for your attention. Thank you for listening and participating.